Welcome back this morning on Your Health. Hope for tough-to-treat depression and other mental health conditions.
Yeah, a new type of clinic is springing up across the country, treating patients with a decade-old drug now being used in a whole new way.
NBC's senior national correspondent Kate Snow joins us with the story.
Yeah, Craig, you guys, you've probably seen the ads, depending on where you live. They're all over social media. We're talking about clinics offering ketamine. It's a hallucinogen known to many people as a party drug. But after more than 20 years of research, some clinics are now using ketamine in combination with psychotherapy to treat a variety of mental health conditions. There are skeptics with concerns, but patients we spoke to say it has changed, even saved their lives.
Inside this New York City clinic, the vibe is less doctor's office, more tranquil spa. Part of what attracted Sherry Scythes to this nationwide chain of clinics offering ketamine-assisted therapy called Field Trip. Sherry has had a lot of trauma in her life, a tough childhood, the death of her mother, a divorce, the loss of her best friend.
I realized that I just had this deep sadness in me and this anxiety in my chest.
That wouldn't go away.
That wouldn't go away.
Friends told her about ketamine. It's FDA approved as an anesthetic, but also an illegal street drug used for its psychedelic effects. Now, a growing number of studies have found ketamine used off-label can be effective for people with treatment-resistant depression.
Patients say, this has changed my life. I feel like I can breathe again.
Mike Dow is a psychotherapist at Field Trip. He says ketamine affects the brain in multiple ways, boosting feel-good chemicals, reducing inflammation, and helping to create new neural pathways that are associated with new habits and behaviors. Patients also undergo a psychedelic experience that can feel spiritual.
Why do you think ketamine might be more effective than other drugs?
Other drugs, they just sort of deal with the surface level, the symptoms. Ketamine works so much better because it's getting to what is underneath.
66-year-old Lynette Eberts has been battling severe depression for nearly 40 years. She tried dozens of antidepressants and other therapies.
I just couldn't see a way out of the pain.
In 2016, before many people had heard about ketamine for depression, her therapist suggested it.
I said yes, when and where. I was very anxious to try it.
Why would you say yes to something that you don't know much about and you don't know if it's proven?
I was so desperate to feel better. I thought trying something is better than not trying anything at all and ending up taking my own life.
Lynette says each 45-minute infusion felt like a dream where she saw vibrant colors and shapes. After her first 3 treatments, she started to feel better.
I started to feel like I could get up and get out of bed. That dark, deep, depressive cloud started to lift.
But now as ketamine clinics continue to spring up across the U.S. and psychedelics become more popular, some doctors are worried it's too unregulated.
My concern is that people who need treatment will spend their time, money, and energy in these ketamine clinics that aren't well proven, and there's also risks associated with that.
Side effects include changes in mood and blood pressure, nausea, and drowsiness. Treatments cost between $400 and $800 on average and are not covered by insurance. At Field Trip, ketamine treatments are supervised by a medical professional like a nurse and happen in conjunction with psychotherapy. We watched as Sherry prepared for her latest session, meditating at first, then receiving a dose. She vividly remembers her first trip last winter.
What happened the first time?
I saw myself as a little girl, and I was in the woods that I loved to be in when I was a child, and then I saw my mother. I felt this unconditional love for her that I couldn't quite feel when she was alive. Once it was over, that deep sadness that was in my body for so long was just gone.
Both Sherry and Lynette say ketamine brought them not just relief, but a newfound happiness.
I know it's changed me.
In what sense?
I'm happier. I'm more confident.
What did ketamine do for you overall?
Ketamine saved my life. Ketamine brought back the joy.
So doctors we spoke to really stressed that ketamine should be given under the supervision of a medical professional who has psychiatric training. That does happen at Field Trip where we were. The drug's effects, guys, can last for as little as a couple of weeks. For some people, the change can be permanent, but for many clients, they do have to keep going back for maintenance treatments.
Wow. I mean, it's so fascinating, Kate. I can't imagine this is a treatment that's for everyone.
Well, it doesn't work for everyone.
Okay.
And something else to keep in mind is that some clinics market ketamine treatments for conditions other than severe depression. And the doctors that we spoke with said, if you look at the medical evidence, there's not a lot of medical evidence that it works for other things other than severe depression that's treatment resistant.
But these clinics are popping up everywhere.
They are. They're really popular.
And she said it changed her life, saved her life. So, you know.
Yeah, and that's why she said she was willing to do it, right? Because she needed that.
A change.
Thank you, Kate.
Thank you, Kate.